Next, I'm going to conduct a mental status and neurologic assessment on my patient. I am inspecting my patient's appearance, and they are dressed appropriately for the weather conditions. They have appropriate cognitive function. Upon assessment, when the patient had presented to the clinic today, they were able to tell me their name and date of birth. Could you just repeat your name for me?
Ian.
And can you tell me where you are today?
I'm at St. Peter's.
And can you tell me who the president is?
Donald Trump.
Okay. And appropriate thought process. Patient's affect is appropriate for the patient's age. Next, I'm going to assess my patient's gait, making sure that it is smooth and rhythmic and coordinated. So I'm going to ask you if you can go ahead and step down off of the stretcher, and if you could just walk towards that wall and back towards me. I'm noting that the patient's gait is smooth and rhythmic and coordinated arm swings. You can go ahead, actually you can stay standing. I'm going to conduct my Romberg Test next to identify homeostasis within my patient. I'm going to have my patient stand with their arms at their side and feet close together, and I'm going to currently be testing cranial nerve 8 at this time. I'm going to ask you if you can close your eyes for me and just stand straight up. I'm going to assess this for 20 seconds to be sure that there are no swaying. The patient isn't swaying during the 20-second period. I'm making sure that I maintain safety by being next to the patient in case there is any swaying noted, that I would be able to catch the patient to reduce the risk of fall. You can go ahead and open your eyes for me, and you can take a seat. I'm going to assess pain and light touch. So first I'm going to divide each extremity in half, including both arms and both legs. And I will also utilize the face at this time as well to be sure that the patient can identify light touch and pain. I'm going to assess pain and light touch. So this is smooth or soft, and this is sharp. So I'm going to assess each extremity in 2 different locations, and I just want you to let me know once I provide the sensation if it's sharp, dull, and where the location is. Okay, so if you can just shut your eyes for me.
Dull on the top right of my arm. Sharp on the bottom right of my arm. Sharp on the bottom left of my arm. Soft on the top left of my arm. Sharp on the top right of my arm. Or leg. Soft on the bottom right of my leg. Sharp on the left bottom of my leg. Sharp on the left top of my leg. Sharp on the top, or on my forehead. Sharp on my left cheek. Soft on my right cheek. Soft on the top right of my forehead.
I was able to identify that my patient was capable of identifying pain and light touch. Next, I'm going to be conducting stereognosis and my patient's identification of the different items. So if you can go ahead and close your eyes for me, I'm going to place a couple objects in your hands, and I would like you to identify them for me.
Okay. A pen. A paperclip. A quarter.
Patient was able to identify all 3 objects. Lastly, I'm going to assess my patient's reflexes, I am looking at my patient's tricep reflexes and their patellar reflexes. So when I am assessing my patient's tricep reflexes, I'm going to use the pointed end of my reflex hammer, and when I assess my patient's patellar reflexes, I'm going to be assessing using the dull, flat edge of the reflex hammer. So I'm going to hold my patient's arm up. If you can just kind of relax your arm for me. Assessing this reflex may be a little bit difficult for your patient. Just try to relax your arm. Again, it is very difficult to assess this reflex on your patient. So I'm going to move on to the patellar reflex. So I'm noting that my patient's reflexes are intact at this time, and that is the end of the mental status neurological assessment.